Hello guys, I am Deepak Shukla. Welcome to our channel Study Mania. Today let's learn about abdominal examination in case of ANC, antenatal case. First thing that we need to do is inspection. In inspection we'll see the shape or distension of the abdomen. If it is longitudinally distended or transversely. Longitudinally distended is seen in cephalic or breech presentation, and transversely distended is seen in transverse lie. We can also see if it is over distended. It is seen in case of multiple pregnancy and polyhydramnios. We need to see if flanks are full or not. That will happen in term pregnancy. Then we need to look for linea nigra, stria gravidarum. Linea nigra is due to increase in aldosterone production and melanocyte stimulating hormone, whereas stria gravidarum is due to tears in dermis due to growth of fetus. Here in this photo you can see linea nigra and stria gravidarum. Other things that you will see in inspection is that all quadrants is moving correspondingly with respiration or not, and you will see for any sinuses scars, okay, or any dilated veins. You'll also see for the hernial orifices if it is intact or not. So in inspection you will follow these things. In palpation, first thing that you need to know is fundal height or uterus height, okay, and that should correspond to week of gestation, okay. And then you have to measure symphysiofundal height in centimeters. Keep in mind, while measuring symphysiofundal height, the leg should be extended, while measuring the fundal height or uterus height, the leg should be flexed and slightly abducted. The first thing that you need to know is that all these fundal grips is performed after 34 weeks of gestation, okay. If we'll do it before 34 weeks of gestation, it is not that significant. So coming to fundal grips, we have 4 grips. The first thing is known as fundal grips, and this helps to identify the fetal pole, okay. One thing keep in mind while performing the fundal grip, lateral grip and the first pelvic grip, that is pollex grip, we have to face towards the face of the patient, okay. We have to face towards the face of the patient. So let's see each one by one, okay. In fundal grip, to identify the fetal pole, how you will say it is head. So head is hard, globular and palatable mass, whereas if you find a soft, broad, irregular, non-palatable mass, it is suggestive of breech, okay. So see here, we are facing towards the face of pregnant female, okay, and this is our first grip. By ulnar border, we need to know the fundus height and what corresponds to it, like it is breech or head. If you are not feeling anything or palpating anything, maybe it is a transverse lie. So this is the first pelvic grip or first fundal grip, sorry. Coming to the second one, we have lateral grip. This lateral grip is to identify the fetal back or limbs, okay. The back is uniformly curved, smooth resistance is felt, okay. It is uniformly curved and smooth resistance is felt, okay. And if it is irregular knob like structures, it is suggestive of limbs, okay. So here we have to place our ulnar border of both the palms on the lateral side, facing towards the face of the patient, okay. So this is lateral grip. Then third thing, we have first pelvic grip, okay. So the first fundal grip, second lateral grip, and then we have first pelvic grip, also known as pollex grip. Here we need to know the presentation of fetus and identify fetal pole that occupies the lower pole of uterus, very important. So which part of the fetus is occupying the lower pole of the uterus, we'll see in the first pelvic grip, okay. In transverse lie, the first pelvic grip is empty, okay. This will also tell if the head is engaged or not, okay. So we'll see it here. So we have seen the first fundal grip, then we have seen the lateral grips. Now we are seeing this third grip, also known as pollex grip, okay. So here we have to keep the ulnar border in the pubic symphysis and look for the head engagement. So this was about the first pelvic grip, that is pollic grip. Coming to the second pelvic grip. Why we need to do the second pelvic grip? Just to confirm the finding of the first pelvic grip. Okay, and this second pelvic grip confirms the presentation. In second pelvic grip, if the hands are diverging, it tells it is engaged head, and if the hands are converging, it is unengaged head. Okay, and we do this second pelvic grip to make out the attitude of fetal head also. So here, this second pelvic grip, we have to face towards the leg of the female. Okay, and we have to see if the hands are converging or diverging. So here we can see if it is diverging and if it is converging. If it is diverging, it means head is engaged. Okay, so there is no place for hands to converge. And if the hands are converging, it means the head is not engaged. So this was about the pelvic grips. This is in general about the cephalic presentation or breech presentation. If there is transverse lie, things will change a little bit. And for auscultation, we need to find the spino-umbilical line. Spino means anterior superior iliac spine and the umbilicus. Okay, so wherever there is a spine of the baby, okay, that side it is easier to hear the fetal heart rate in the spino-umbilical line. Okay, so this was about the auscultation in a cephalic presentation. Other things will change in transverse position or other positions also. So this was about simple things about the abdominal examination in ANC case. Thank you so much.